A physical examination by a doctor comes next. Eddie would be assessed for signs and symptoms of withdrawal. An instrument that is widely accepted for the assessment of alcohol withdrawal is the revised Clinical Institute Withdrawal Assessment for Alcohol Scale, or CIWA-AR. Eddie will be prescribed diazepam and the dose adjusted based on his CIWA score. It is common for people who are alcohol dependent to have inadequate thiamine intake. Alcohol withdrawal increases the body's need for thiamine, and thiamine deficiency is a risk factor for Wernicke-Korsakoff syndrome. Eddie will receive an injection of thiamine to prevent this, and he will be given a month's supply of thiamine to be taken orally as a dietary supplement. Eddie is likely to stay in the facility for 5 days. The focus during this time is providing a quiet environment and reassurance with monitoring of his withdrawal.
We don't let people outside without supervision. That's because we think it's important for them, both in terms of ensuring that they're safe, but also in terms of the temptations that they might succumb to were they to leave. Inevitably there are alcohol retail facilities close by, and so it's important that we don't expose them, particularly while they're feeling very, very vulnerable to stimuli such as that.
There are organised activities to distract from the discomfort of withdrawal. Little is provided in the way of counselling, but attention is paid to planning aftercare.
Obviously this is just the first step in the process. It's really important to recognise that what we're trying to do is to get people to engage in a treatment process, and this is just the first step in that. We don't provide very much. That's quite deliberate, because while people are going through withdrawal and taking medications, obviously they're not really in a position to be able to engage in sort of deep and meaningful counselling. So what we do is introduce them to various services that are available afterwards. So we get non-government organisations to come in and actually talk about what sort of services are available. Also talk about our own service, the Woolshed, which is a therapeutic community, and really sort of try and focus on that aspect of things. We also involve groups such as the Hepatitis C Council, so that they actually are given a little bit of information and education. And we just have a small group once a week which focuses on relapse prevention. The sort of things that people do here that might be considered to be group activities are more about diversional group activities, which is much more pitched at the level that they're able to engage. So AA and A are important. And we certainly ensure that we provide people with I guess, a smorgasbord of options, if you like, so that then that they can find what it is that suits them. And that will be self-help type things. It might be structured rehabilitation programs, but also might be, pharmacotherapies to reduce craving, for example, such as, say, camprosate and naltrexone. We talk to them about that too.